Irritable bowel syndrome is one of the most prevalent gastrointestinal conditions in the world, but its treatment remains unsatisfactory. Recent information has surfaced suggesting that the disruption of the bacteria living in the bowel may be at the heart of this disease. As a result, more and more authorities are recommending probiotics for the treatment of IBS. This video takes a look at the use of probiotics in IBS. Irritable bowel syndrome is a functional gastrointestinal disorder that is probably the most prevalent gut disorder in the world. It affects about 10 to 20% of the world's population and has an enormous psychological, social, and economic impact. It is diagnosed in people who complain of abdominal pain for at least 6 months and for at least once a week in the 3 months prior to their diagnosis, accompanied by changes in the consistency or the frequency of their stools. All of this must appear in the absence of any other known causes for their symptoms. The cause of irritable bowel syndrome is still unknown, but it may be a combination of genetic as well as environmental factors such as diet, infection, or psychosocial stress. There are several factors that may play a role in causing the symptoms of irritable bowel syndrome, such as a leaky gut, or hypermotility of the bowel wall, or hypersensitivity of the bowel wall, known as visceral hypersensitivity. Or there may be inflammation in the wall of the bowel, or there may simply be an imbalance in the bacterial flora living in the bowel. This is known as gut dysbiosis or intestinal dysbiosis. The collection of bacteria living in the bowel is called the microbiome, and the microbiome consists of bacteria, fungi, and other microbes. There's growing evidence that intestinal dysbiosis or gut dysbiosis, the imbalance of these bacteria living in the bowel, may have a central role in the pathogenesis of irritable bowel syndrome. For this reason, multiple studies have been done looking at the treatment of irritable bowel syndrome with probiotics. Probiotics are products that contain live, helpful bacteria that, when consumed by the host, provide a benefit to the host. Because probiotics have not been standardized and the symptoms of irritable bowel syndrome are diverse and varied, it is difficult to make a comparison between studies. Scientists have still, however, been able to determine how probiotic bacteria exert their beneficial effect in irritable bowel syndrome. Number one, probiotic bacteria can they can fix the broken microbiome. Probiotic microbacteria compete with and inhibit the adherence of harmful bacteria to the walls of the bowel. They do this through the secretion of surfactants and antimicrobial peptides and the secretion of short-chain fatty acids. Antimicrobial peptides or bacteriocins are molecules produced by the bacteria in probiotics that are harmful to harmful bacteria in the bowel. And short-chain fatty acids produced by the bacteria in probiotics during the breakdown of undigested carbohydrates in the bowel produce short-chain fatty acids. And these short-chain fatty acids can lower the pH in the bowel and make it more inhospitable to harmful bacteria. Surfactants are anti-inflammatory molecules that are secreted by the walls of the bowel. Probiotic microbacteria can improve symptoms of irritable bowel syndrome through the strengthening of the barrier function of the bowel wall. This is achieved through the secretion of mucus, the secretion of proteins that form the tight junctions between the cells in the bowel wall, the secretions of antimicrobial peptides or bacteriocins, and the secretion of short-chain fatty acids. Harmful bacteria are prevented from infecting the bowel wall because they first have to pass through the layer of mucus that lines the bowel wall. Thirdly, probiotic bacteria can exert an anti-inflammatory effect on the wall of the bowel. This they can do by inhibiting the secretion of chemicals known as inflammatory cytokines, which cause inflammation in the wall of the bowel. Short-chain fatty acids produced by bacteria in the bowel, probiotic bacteria, can lead to the inhibition of the secretion of tumor necrosis factor alpha, a powerful inflammatory cytokine. These bacteria can also induce the secretion of interleukin 10, an anti-inflammatory cytokine, thereby reducing the amount of inflammation present in the wall of the bowel. Fourthly, the bacteria contained in probiotics may improve the immune function of the bowel wall. And this they can do by stimulating the secretion of immune globulin A. Immune globulin A is an antibody that is secreted from the bowel wall plasma cells into the lumen of the bowel, where they can destroy harmful bacteria in the bowel. Lactobacillus casei has been shown to increase the secretion of immune globulin A in the wall of the bowel during infection. Finally, probiotic bacteria may improve the communication between the brain and the gut. Probiotics have been shown to decrease visceral hypersensitivity, which generally manifests as bloating and pain and urgency. Probiotics may also control the motility of the bowel wall by acting directly on the nervous system of the gut, the enteric nervous system. Irritable bowel syndrome is a multifactorial disease, and the human microbiome is highly variable from person to person among healthy people as well as persons suffering from irritable bowel syndrome. In addition to this, it appears that the actions of probiotics are species specific, so that it is difficult to make any concrete recommendation on a specific strain. Most of the studies done on the treatment of irritable bowel syndrome with probiotics utilized lactobacilli as well as bifidobacteria. And Alfred Nissel had already demonstrated the efficacy of the E. coli Nissel 1917 strain in the treatment of bowel infections and diarrhea. The majority of studies that were done reported results in patients after a treatment course of 12 weeks. Based on this information, a 12-week trial of a combination of lactobacilli, bifidobacteria, and E. coli Nissel 1917 is a good option for the treatment of irritable bowel syndrome. Of course, if there is no response within the 12 weeks or there are adverse side effects, the course should be discontinued. As always, it is important for us to discuss any treatment regimens with our providers. Thank you for watching. You can support this channel by subscribing. Until the next video, stay healthy and stay safe.